Chapter 4, the knee-to-knee examination.
When I have a mom and a young child come into the practice, we sit down and do what's called a knee-to-knee exam. It doesn't take any special equipment. It's actually a wonderful, fun way to meet a new child and to get the mom comfortable with how we treat and look at a young smile.
Well, the first time I did an exam on a 1-year-old, I found it to be a little terrifying, a little intimidating. But once we found how the process went and we felt very comfortable working with the child and realizing it was really a very simple type of examination process and what you're trying to accomplish, I found it to be a very, very simple, easy process.
Before the actual knee-to-knee examination begins, the medical and dental history should be evaluated, as well as a discussion with the parent to gather caries risk information for the child. Then the knee-to-knee examination begins by explaining to the parent that children under age 3 cannot be expected to cooperate for such dental examinations while sitting in the dental chair. This comes as a relief to many parents.
It's really easy to examine a 1-year-old. We use a method that's called the knee-to-knee method. This is where the parent and the practitioner sit across from each other in a knee-to-knee fashion. The parent lays the child's head back into the practitioner's lap. The child hopefully will be crying, and if the child's crying, then we have a really good access to do a really good visual examination.
Prior to examination, the parent is also asked to hold the child's hands so that the child does not grab the practitioner during the examination. After this, the child's head is placed in the practitioner's lap and the examination is started. The examination begins by evaluating for white line lesions, visible biofilm, gingivitis, and enamel defects. If present, posterior teeth are evaluated for deep pits and fissures. All of these items are important clinical caries risk indicators. The soft tissue is then examined for pathology or soft tissue disturbances, including Bohn's nodules, Epstein's pearls, or eruption cysts. If a mouth mirror is used during the examination, care must be taken so the child does not bite down on the mirror. Experience has shown that during most knee-to-knee examinations, the child is crying, so biting is not usually an issue. Following the soft tissue examination, an evaluation of the developing dentition is conducted to ensure that the child has the correct number of teeth for their age and that the eruption of the teeth is symmetric. If any disturbances in either the eruption or functional occlusion exist, these should be evaluated and noted. Next, an oral hygiene demonstration can be performed. The facial surfaces of the upper anterior teeth can be disclosed and the parent shown the biofilm, which is then removed with a gauze square, toothbrush, or prophy cup. After this, based on the child's caries risk assessment, a fluoride varnish can be applied. When all of these steps are completed, the child is instructed to sit up and the anticipatory guidance portion of the appointment begins.